am going to talk about aminoglycosides and their toxic potential. To name some of the aminoglycosides, streptomycin, gentamicin, tobramycin, amikacin and neomycin. Aminoglycosides are potent bactericidal agents and are used for treating serious gram-negative infections such as complicated hospital-acquired pneumonia, complicated UTI, septicemia and so on. Despite their efficacy, they share notable toxicities, namely nephrotoxicity, ototoxicity and neuromuscular blockade. Now let's discuss the various types of toxicities that are caused by aminoglycosides. To begin with, nephrotoxicity. Aminoglycosides are filtered by the glomeruli, taken up by the proximal tubular cells, where they cause damage to the proximal tubular cells, leading to acute kidney injury. So what is the underlying mechanism for the kidney injury caused by aminoglycosides? Aminoglycosides are trapped by the proximal tubular cells and they inhibit the lysosomal phospholipase A2 enzyme, which is a key enzyme responsible for degradation of phospholipids. Because of inhibition of lysosomal phospholipase A2, there is increased accumulation of phospholipids. The increased accumulation of phospholipids causes distension of the lysosomes, causes enlargement of the lysosomes, causing weakening of lysosomal membrane and rupture, releasing the enzymes into the cytoplasm and activation of apoptotic pathways. Due to activation of apoptotic pathways, there is autodigestion of the cellular components and also release of iron, which causes the formation of reactive oxygen species. So there is increased production of reactive oxygen species that causes mitochondrial damage, and because of mitochondrial damage there is ATP depletion, further activating the apoptotic pathways. So stimulation of apoptotic pathways, formation of reactive oxygen species, mitochondrial damage, oxidative stress leads to proximal tubular cell death. So there is damage to the proximal tubular cells and this causes renal dysfunction and failure of the kidneys. Clinically, the patient presents with rise in blood urea, nitrogen and creatinine. There can be electrolyte imbalance such as hypokalemia, hypomagnesemia, proteinuria can also occur, and there is decrease in glomerular filtration rate, which is an indication of renal failure. Now let's compare the nephrotoxic potential of various aminoglycosides. The safest aminoglycoside in renal disease is streptomycin. It has lowest nephrotoxic potential. So streptomycin has lowest nephrotoxic potential. Aminoglycosides that produce significant nephrotoxicity are gentamicin and tobramycin. And neomycin also is most nephrotoxic and therefore they are not administered systemically. So neomycin, which is an aminoglycoside, is most nephrotoxic when administered systemically and therefore it is administered topically because of its nephrotoxic potential. So what are the risk factors for nephrotoxicity? Concurrent use of aminoglycosides with drugs such as amphotericin B, vancomycin, cisplatin, cyclosporin should be avoided because it increases the risk of nephrotoxicity. Also, high doses of aminoglycosides and prolonged therapy should be avoided because it increases the risk of renal dysfunction. Next is ototoxicity. Aminoglycosides accumulate in the inner ear fluid, that is endolimb and perilip, and causes damage to the hair cells of the cochlea and the vestibular system, causing hearing disorders and balance disorders. Because of damage to the hair cells of the cochlea, there can be hearing disorders, and damage to the vestibular hair cells can cause balance disorders. So what is the underlying mechanism? What causes damage to the hair cells? Aminoglycosides enter into the hair cells via voltage gated channels. So through voltage gated ion channels, aminoglycosides enter into the hair cells and produce reactive oxygen species. The reactive oxygen species causes mitochondrial damage and increases oxidative stress, mitochondrial dysfunction and activation of apoptotic pathways. It causes apoptosis of the hair cells. So apoptosis of outer hair cells of the cochlea causes loss of high frequency sounds first, And once the outer hair cells are lost, the hearing loss progresses from high frequency sounds to lower frequency. So hearing loss is due to damage to the outer hair cells of the cochlea, and amongst the various aminoglycosides, amikacin is more likely to cause hearing disorders. Neomycin is most cochleotoxic and therefore it is administered topically. It is not administered systemically because of its ototoxic and nephrotoxic potential. So what happens when there is damage to the vestibular hair cells? This results in balance disorder and the patient presents clinically with ataxia, dizziness and loss of balance. So aminoglycosides that produce vestibular toxicity are streptomycin and gentamicin. So streptomycin and gentamicin are more likely to cause balance disorders, and this is due to damage to the vestibular hair cells. Now the aminoglycosides persist in the inner fluid for weeks to months, and this increases the risk of ototoxicity. So imagine a patient being treated for serious infection with an aminoglycoside only to realize days later that his hearing is fading. This could be a side effect of aminoglycoside. So ototoxicity is one of the important side effects of aminoglycosides. Now the third important toxic effect of aminoglycoside is neuromuscular blockade. So it increases the risk of flaccid paralysis in myasthenia gravis, which is associated with deficiency of acetylcholine. As we know that muscle contraction is due to the release of acetylcholine at the neuromuscular junction, which binds to the NM receptors. So acetylcholine that is released at the neuromuscular junction binds to the NM receptors, the nicotinic receptors, to cause muscle contraction. So how do aminoglycoside increase the risk of neuromuscular blockade? As we know that muscle contraction is mediated by acetylcholine, which is a neurotransmitter which is released by the neuromuscular junction, and it binds to the NM receptors, which mediates muscle contraction. So how do aminoglycosides enhance neuromuscular blockade? Aminoglycosides reduce calcium entry into the nerve fibers, and this decreases the release of acetylcholine into the neuromuscular junction. So there is reduced release of acetylcholine into the neuromuscular junction, thus decreasing the muscle contraction. Secondly, there is blockade of the postsynaptic NM receptors. So because of blockade of the postsynaptic nicotinic receptors, the acetylcholine that is available in the synaptic cleft at the neuromuscular junction is not able to act on the receptor. So there is blockade of the NM receptors by the aminoglycosides, and this also inhibits contraction. So neuromuscular blockade is caused by decreased release of acetylcholine at the neuromuscular junction and also blockade of NM receptors at the muscle end plate, and together it increases the risk for neuromuscular blockade. Aminoglycoside that has highest neuromuscular blockade property is streptomycin. So streptomycin has highest neuromuscular blockade property. It increases the risk of flaccid paralysis, should be avoided in myasthenia gravis. So aminoglycosides such as streptomycin should be avoided in patients with myasthenia gravis. Also, it should not be used concurrently with other neuromuscular blockers such as becuronium, atracurium, and this increases the risk of neuromuscular blockade and flaccid paralysis. High doses of prolonged therapy should be avoided because of its neuromuscular blockade property. However, to be kept in mind that if there is neuromuscular blockade, the flaccid paralysis can be reversed by using neostigmine and calcium gluconate. So neostigmine, calcium gluconate helps to reverse neuromuscular blockade if at all there is flaccid paralysis. So we have discussed the various toxicities that are associated with aminoglycosides, the mechanism, and which drug causes what kind of toxicity. If you find my video useful, please like, share and subscribe to this channel. Thank you for watching.